previous biotechnology. Today, the topic of my presentation is black knot. Black knot is a fungal disease that affects various species of trees in the Prunus genus, which includes cherries, plums, and other stone fruit trees, including ornamental edible and native plum and cherry trees. It is caused by the fungus Epiosporina morbosa. Here's some information about black knot. Hard swollen black galls, tumor-like growth, form on branches and occasionally on trunks. Many prunus trees tolerate black knot. Tolerant trees have many galls throughout the tree with few negative effects on the health of the tree. Some prunus trees are more severely affected by black knot. In these trees, leaves and shoots wilt and die on branches with galls. Management will vary depending on how severely the tree is affected by black knot. Appearance: black knot appears as swollen, black and hard galls or knot on branches, twigs and stems of affected trees. The knots can vary in size and shape but are typically elongated and can grow up to several inches long. When young, they may have a greenish appearance, eventually turning black and rough. Fungal life cycle: the black knot fungus overwinters in the affected knots on the tree. During the spring, fungal spores are released from the mature knots and are spread by wind and rain. These spores infect susceptible trees through wounds or natural openings, such as leaf scars or pruning cuts. Once infected, the fungus grows within the tree tissues, causing the characteristic black knot. Symptoms and effects: as the black knot disease progresses, the galls expand, causing the affected branches to become deformed and weakened. Infected branches may have stunt growth, reduced foliage, and dieback. Severe infestations can lead to significant damage, including branch dieback and tree decline. Host plants: black knot primarily affects trees in the Prunus genus, including sweet and sour cherries, plums, peaches, apricots, and related ornamental species. Different species and cultivars within the Prunus genus may vary in their susceptibility to black knot. Branch symptoms: black knot galls are most noticeable during fall and winter after all the leaves have fallen. Knobby, swollen black growths called galls grow along the length of stems and branches. In early summer, young galls or new areas of growth on the edges of older galls are covered with velvety olive green spores. These galls turn black and hard by the end of the summer. Infected branches may bend to one-sided due to growth of the galls. There can be anywhere from a few galls to hundreds of galls within the tree canopy. Leaf symptoms: leaves remain healthy and green even on branches with galls in black, not tolerant trees. Leaves wilt, turn brown, and die on branches with galls in trees that are highly susceptible to black knot. Brown, wilted leaves at the end of branches are often scattered throughout the trees on highly susceptible trees. Trunk symptoms: large areas of rough black swollen bark from on the main tree trunk. Black knot galls on trunks are often cracked and may ooze sticky liquid. Wood decay fungi may enter the trunk through cracks caused by black knot galls and cause wood rot. How does black knot survive and spread? Black knot is caused by the fungus Aposporina morbosa. The black knot fungus overwinters in the galls on branches and trunks. Spores are released during wet periods in the spring. The wind carries these spores to trees where they infect young tree shoots or wounded branches. The fungus grows within the branch for several months with no outward symptoms of disease. As the fungus grows, it releases chemicals that make the tree grow extra plant cells that are unusually large. This unusual growth results in the swollen, woody galls. Galls are made up of both plant and fungal tissue. 1 year after infection, galls can be seen as a swollen area of the branch with a velvet olive green covering of fungal growth. 2 years after infection, the gall has turned black and hard. These galls release spores in spring when wet. Sometimes the branches and the gall die after spores are released in early spring. If the branch lives, the knot keeps getting bigger and produces new spores every spring. The gall can completely encircle and girdle a branch. When this happens, the leaves beyond the galls wilt and die. Although the black knot fungus will not cause the trunk to rot, the cracks from the infection can let and other wood rotting fungi. How to manage black knot? There are several ways to manage black knot, like site and tree selection, pruning out galls, using fungicides, site and tree selection. In areas where there are many wild prunus infected with black knot, avoid planting landscape and edible prunus. If only a few infected wild prunus are present, prune out exciting existing galls or completely remove infected plants to reduce the amount of fungal spores present before planting landscape and edible prunus. Site and tree selection. Choose that trees which have some tolerance to black knot. See tree list above under trees affected by black knot in Minnesota. Inspect all trees and shrubs for black knot before purchasing them from the garden center. Do not purchase any trees with black knot galls. Pruning out galls. Black knot galls can be removed from infected trees through pruning. This will make ornamental plants look better and reduce the amount of fungal spores produced within the tree canopy each spring. Pruning out gall is not necessary in trees where black knot galls do not result in wilt and death of leaves and young branches. Pruning cuts should be made in late winter, February or March, when temperatures are below freezing. This will prevent black knot spores from infecting the pruning wound. Make the pruning cut at least 4 inches below the black knot gall. Infected branches should be removed from the area and burned, dried, or disposed of. Infected branches left below the tree will continue to release spores that can start new infections in the tree. To maintain a black knot free tree, it will be necessary to inspect the tree and prune out any new galls each winter. Cracked and oozing galls on trunks or large branches should be inspected by a certified arborist to determine if the tree is stable. Black knot will not rot wood, but wood decay fungi can enter through cracks caused by black knot. These fungi cause wood rot that weakens the tree. Using fungicides. Fungicides can be used to protect young trees or trees that will be severely affected by black knot. Prune out any existing galls in late winter before applying fungicides in spring. Fungicide sprays must be applied in early spring to protect young green shoots. Begin fungicide treatment when flower buds are just beginning to open. Repeat sprays according to label instructions until shoots mature or weather is consistently warm or dry. Sprays work the best when applied before a rain event when temperatures are warmer than 60 Fahrenheit. Before applying fungicide, read the label carefully. The plant to be treated must be listed on the label or the fungicide cannot be used on the plant. Not all fungicide registered for use on ornamental prunus varieties can be used on edible prunus varieties. For large trees, high pressure spraying equipment is needed in order to get complete coverage. Hire a professional arborist who can safely operate all necessary equipment. Fungicides with one of the following active ingredients are effective in protecting trees from black knot: Captain, chlorothalonil, thiophanate methyl, lime sulfur. Control and management over black knot, pruning and sanitation. Prune and remove infected branches. Prune infected branches during the dormant season, making cuts at least 4 to 6 inches below the visible knot. Disinfect pruning tools between cuts to prevent spreading the fungus. Pruning and sanitation. Dispose of pruned branches. Burn or dispose of the pruned branches away from the infected area to prevent spore dispersal. Regular monitoring. Regularly inspect trees for any signs of black knot and promptly remove and destroy infected branches throughout the year. Cultural practices. Plant resistant varieties. Choose disease resistant varieties when planting new tree to reduce the risk of black knot infection. Proper spacing and pruning. Maintain adequate spacing between trees to promote good airflow, which helps reduce humidity and fungal spread. Prune trees to allow for better light penetration and air circulation within the canopy. Tree health maintenance. Keep trees healthy through proper watering, fertilization, and overall good tree care practices. Healthy trees are better able to resist and recover from diseases. Chemical control. Fungicidal sprays. Fungicides can be used as preventive measure to protect healthy trees from black knot infection. Apply fungicides during the dormant season before bud break or in early spring when new growth is emerging. Consult with a local extension service or arborist for specific fungicide recommendations suitable for your region and tree species. Monitoring and prevention. Regular inspections. Regularly monitor your trees for early signs of black knot, including the presence of galls or knots on branches. Promptly take action to remove infected branches. Prevention in neighboring areas. Collaborate with neighboring property owners to ensure proper black knot management. The disease can spread through wind dispersed spores, so collective efforts can help reduce the overall disease pressure. It's important to note that black knot control may require a multi-year approach as the fungus can persist and reinfect trees. Consistent and diligent management practices are crucial for long-term control of the disease. Consulting with local experts such as arborists, horticulturalists, or agricultural extension services can provide region specific guidance and recommendations for effective black knot control. Thank you. This is all about the topic of black knot.